A group of Australian scientists, led by Dr. Lambert, set out to determine the effects of sunlight exposure as well as season on the synthesis of serotonin. But what is serotonin? Serotonin is a neurotransmitter that is synthesized in the gastrointestinal tract and brain from amino acid L-tryptophan. Reduced levels of serotonin have been correlated with depressive symptoms. This led to Dr. Lambert's hypothesis, stating that if there is a greater number of hours of bright sunlight per day, then this would lead to increased serotonin synthesis, which in turn would reduce depressive symptoms. In other words, Dr. Lambert believed that sunlight would increase serotonin levels and reduce depressive symptoms associated with seasonal affective disorder. It is also vitally important to understand that this experiment took place in Australia. So in the months of December to February is the middle of summer, and therefore the days are longer, whereas the months of June through August are winter and have days with less sunlight. This primary study was done with 101 healthy men between the ages 18 and 79. They were chosen as participants for the experiment after undergoing a physical and clinical examination to detect any diagnosed medical problems. It is assumed that women were not included as participants because their menstrual cycles can alter the amounts of serotonin production, causing a fluctuation that would be difficult to account for during the experiment. The endometrial cycle causes low progesterone levels, which have been proven to have a correlation with low serotonin. As previously seen in this course, other scientists faced similar obstacles when dealing with rats, leading to exclusion of female rats from their study for many of the same reasons. Serotonin is not easily detected in the blood, and therefore the researchers tested for levels of 5-hydroxyndole acetic acid, or 5-HIAA for short, which is a marker for serotonin, meaning it is created when serotonin is metabolized.
To test serotonin synthesis in the brain, the scientists used jugular catheters, which may seem extreme if you know anything about catheters or jugulars. This was done to reduce the detection of serotonin production from the gut in the samples, since only serotonin produced in the brain was under investigation. Blood samples were taken simultaneously from the jugular artery and vein to allow scientists to determine the 5-HIAA levels going into the brain compared to the 5-HIAA levels going out. The catheters were inserted before breakfast in the morning for all participants while they laid in the supine position. Caffeinated beverages and tobaccos were prohibited 12 hours prior to the study, as both can have an effect on serotonin levels. The blood that was obtained from each participant was immediately placed inside chilled tubes and centrifuged in order to isolate the plasma from each sample. The plasma that was taken from each participant was stored at negative 80 degrees Celsius until the samples were transported to the lab to be studied. Whole body production of serotonin was tested on only 26 of the individuals through a renal 5-HIAA test. For healthy individuals, the whole body production of 5-HIAA and the renal secretion of 5-HIAA were equal. Precise meteorological data was obtained from the Australian Commonwealth Bureau of Meteorology to detect the amount of hours of what was considered bright sunlight in one day. Bright sunlight was defined as sunlight which had sufficient intensity to burn a trace on a chart when the sun rays were magnified through a glass sphere, known as a Campbell-Stokes recorder. Other meteorological data was taken each day, including highest and lowest temperature, mean atmospheric pressure, and total rainfall, none of which proved to have significant effect on the serotonin synthesis.
During the Australian winter months, June and August, whole brain serotonin production was reduced. Brain serotonin turnover had a significant correlation with the prevailing amount of bright light on the day of the study. It was not directly related to the hours of sunlight on the day before the study took place. Serotonin production in the brain was observed to be affected by acute luminosity changes, meaning that higher levels of 5-HIAA were observed on bright days, and lower levels were observed on dull days. It is important to note that norepinephrine and dopamine levels were also tested, but their levels in the body did not prove to fluctuate according to meteorological changes, including amount of bright sunlight. The result of the experiment supported Dr. Lambert's hypothesis, stating that a greater amount of sunlight leads to an increase in brain serotonin production. Dr. Lambert and his associates concluded that the prevailing amounts of sunlight do have an effect on brain activity involving serotonin, and therefore can be said to underlie mood seasonality and seasonal affective disorder.
Local advertising in the community procured participants for this experiment. The participants were compensated $50 for their involvement in the study. The participants were required to undergo the procedure of obtaining jugular blood from a catheter on one occasion only. In concurrence with most invasive procedures, the participants could not consume food, caffeine, or smoke any tobacco 12 hours before the procedure. The procedure took place in the early morning, which allowed the fasting period for the participants to take place overnight, reducing potential discomfort due to hunger or cravings for either tobacco or caffeine. There was little trauma inflicted onto the participants, only mild bruising occasionally around the puncture site. This experiment was approved by the Alfred Hospital Human Research Ethics Committee and followed the National Health and Medical Research Council of Australia's guidelines. In the early 2000s, the Research Ethics Board between the United States and Australia were comparable. The omission of women as test subjects was a calculated exclusion due to the challenges associated with the menstrual cycle, in which serotonin levels are known to fluctuate without correspondence to meteorological changes, thus proving to be difficult to account for.
Limitations. This experiment had quite a few limitations, the most obvious being the exclusion criteria. A great deal of people were unfit to participate in the study, including all women. In addition to not having a Y chromosome, you could be excluded for having any significant medical condition or a history of affective disorders. This limits the validity of the results because it could be argued that they do not apply to women. In addition, seasonal affective disorder impacts some people more than others. Not everyone gets depressive symptoms come December, but nobody who identified as a sufferer of affective disorders was allowed to participate in the study. It is possible that people who are predisposed to affective disorders could respond to environmental stimuli in a different way than the healthy people who were tested. This could be improved upon in future studies by including women and people who identify as suffering from SAD as participants. The most glaring limitation is the fact that each person involved in the study was only tested once. People are clearly different from one another, and serotonin levels are highly personal. As a result, comparing levels of 5-HIAA between different people adds another variable and decreases the accuracy of the results. Ideally, each participant would be observed multiple times over the span of a year to compare the amount of sunlight with their serotonin levels. However, it is understandable why this was not done, as repeatedly puncturing the jugular vein is less than ethical and would require significantly higher incentives to obtain willing participants. Another limitation that may have an effect on the precision of the data is the rate of serotonin metabolism. If serotonin that is synthesized in the brain has not been metabolized into 5-HIAA by the time it reaches the jugular vein, it will not show up in the sample.